Thank you for coming forward and considering being a potential living kidney donor for your loved one, a family member or a friend. Or maybe you are considering being an altruistic kidney donor and donating to a stranger.
This section is designed to share with you the information that we have on living kidney donation. Although we believe that live kidney donation is the best treatment we can offer to a patient with kidney failure, it should not be undertaken lightly, and it's essential that everyone involved understands the risks and benefits. A live donor transplant involves operating on a person who is perfectly fit and does not actually need an operation. This is an unusual situation for healthcare professionals too, and it's important that such decisions are made with all the information available and after careful consideration.
With this DVD, there's some information that explains the workup and special tests and investigations required in being a live donor. Please discuss this with your family members and friends. Live donor workup normally takes between 3 and 6 months to complete. This is depending on your suitability as a live donor, your medical history, or maybe also your age. Donor health is our main priority, and it is very important to keep risks to a minimum. This includes live donors being of a healthy weight and also non-smokers.
After discussing the possibility of donation with your friends and family, you will need to contact the specialist nurses who are involved in organising the live donation process. It's possible to have an informal chat on the telephone and seek some basic information in the first instance. If you wish to go further, they will send you a basic health questionnaire which collects information about any previous illnesses that you have had and the basic state of your health. You will need to return this questionnaire to the specialist nurses, who will then set an appointment for you. We will also send a similar form to your GP.
Some people have large families and have lots of people who come forward as donors for them. We look at everybody on an individual basis, and then we would choose one person to proceed and have the tests and investigations performed. All live donors will meet with a live donor coordinator and talk through the donor health questionnaire. At this appointment, you may also have some basic blood tests performed, a chest x-ray and an ECG, which is a simple test of the heart.
These tests are performed to check that your basic health status is satisfactory and that your kidneys are working normally. It's also important to rule out any potential significant illnesses such as diabetes or heart disease in someone who wishes to become a live kidney donor.
None of your information, tests or investigations are shared with the recipient or any other family member. It's also important that you understand that you can withdraw at any time, and anything between yourself and the live donor coordinator is always confidential. The first test that we would do is a blood group compatibility test. This test is to see whether you and the person that you wish to donate to are blood group compatible. The second test that we would perform is a tissue typing blood test that also tells us if you are tissue type compatible with the person that you wish to donate to. This test is rather like doing a kidney transplant in a test tube. This is a booked test with our tissue typing lab and also requires consent for storage of blood. Occasionally, live donors and recipients are blood group or tissue type incompatible. This does not mean that you cannot be a live donor for your recipient. We can enter you as a pair into the National Kidney Sharing Scheme, and there is an information leaflet about this in the pack. Alternatively, we can look at you as individuals and see if we can overcome blood group or tissue type incompatibility, where the recipient may receive some specialist treatment.
The next step is to meet the doctors, like myself, who are involved in assessing patients for potential live kidney donation. Your specialist nurse will also be present at this appointment. The doctor will go through your medical history and examine you to check there is nothing that could stop you becoming a live donor. If nothing to stop you has been identified, you will move to the next set of tests. These check that you have 2 kidneys. Occasionally, a person has only 1 kidney and has no problems from this. They will also check that they are functioning equally. We will check the exact level of your kidney function with a more precise test. This is because we need to be sure that it is safe to remove one of your kidneys and that you will be left with sufficient kidney function for your own health after donation. If you are older, it is possible that you will need more tests. In some cases, this will involve an exercise test. This means walking on a treadmill whilst having a heart tracing. Again, this is to ensure that it is safe for you to undergo the donor operation. It's also important to have appropriate cancer screening, which involves breast and cervical screening in women and testicular examination in men. If appropriate, bowel cancer screening may also be performed. These tests are essential to prevent the transmission of any cancer to your intended recipient. It is possible that the tests you will have will uncover significant health issues for you yourself. It is uncommon for this to happen, however, but if it does, we will ensure that you are referred to the appropriate specialists to have any treatment that you need. Next, we will organise a final test to look at the blood vessels supplying your kidney. Although many people have 1 artery and 1 vein supplying their kidney, it is quite common to have more than one. The surgeon needs to know this before the operation can be planned, because if there are too many blood vessels, it may not be possible to remove your kidney and implant it into your intended recipient. The doctors, surgeons and specialist nurses involved in live kidney donation meet regularly to review the tests that potential live donors have, so we can make decisions about individual potential donors. If all these tests are satisfactory and no concerns have been raised about you becoming a live kidney donor, a date will be set for the operation, which is convenient to both you and the recipient, assuming that everyone still wants to go ahead. An appointment will be made for you to meet the surgeon who will be responsible for retrieving the kidney at operation. We have some flexibility about these timings, so we can take account of planned foreign travel, school holidays, exams, and so on. It's possible that your donor assessment will be carried out at one hospital and you'll be referred to another hospital, the transplant centre, for the operation itself. In this case, your kidney specialist will refer you to the transplant team in the usual way and you will be seen prior to the surgery. You'll also be asked to see an independent assessor, who is a person who has no professional interest in the transplant programme. Since the passing of the Human Tissue Act in 2006, it has been necessary by law for every donor to see an independent assessor. This person is completely independent and has nothing to do with the transplant team. Their role is to check that you are donating a kidney of your own accord, without external pressure and without financial gain. They will also check that you understand the risks of the procedure and what is involved. It's possible to donate a kidney as an act of charity, even if you do not know anyone who has kidney failure. This process has received a lot of media attention in the last few years, with several high-profile cases. It is known as altruistic donation. The assessment process to become an altruistic live kidney donor is identical, except that you will also undergo a psychological assessment. More information about the Human Tissue Act and the Human Tissue Authority is available on their website at www.hta.gov.uk. For the majority of live kidney donors, there is no major impact on their long-term health. We can tell this by comparing them to people of the same age and sex who have not donated a kidney. However, we cannot guarantee that there will be no long-term impact on your health. Some studies have suggested very small, long-term increases in the risk of death or needing dialysis amongst live donors. However, other studies have suggested that live donors actually live longer than comparable people in the same population. Overall, we believe you can become a live kidney donor without significant risk to your long-term health. You do need to be aware that there is a mildly increased risk of high blood pressure requiring you to take medication. This is only a mildly increased risk, and most people do not need to be on any special medication related to having been a live kidney donor. Some women are concerned that becoming a live kidney donor might affect their chances of having children. Happily, it has no effect on fertility, and women of childbearing age can expect to have normal pregnancies after donating a kidney, the same as anyone else. It is sensible to let your GP and midwife know if you are in this position so that they can monitor your kidney function during pregnancy. You can lead a normal, healthy and active life after donating a kidney. After all, some people are born with one kidney and never know that they only have one and have no problems. We're always delighted when someone comes forward as a potential live kidney donor, since we believe it is the best treatment we can offer to a person with kidney failure.
If you have any questions about being a living kidney donor from the DVD or the information pack, please feel free to contact us. If you are happy to proceed, you could complete the donor health questionnaire and return it to us in the envelope provided, and we will be in contact when we have received that questionnaire.